Hello everyone, I am an expert from VCU Health, Virginia Commonwealth University Health. Have you ever heard the phrase, the silent killer? We doctors often use it. It sounds a bit dramatic, doesn't it? But trust me, when it comes to high blood pressure, those words are very accurate. It is called silent because it sneaks through the body without any warning. You don't see it, don't hear it, don't feel it, yet it is quietly changing your future. And it is called a killer because when it makes itself known, it is usually through a heart attack, a stroke, or sudden memory loss. Let me tell you a story. A few years ago, I had a patient, Mrs. Margaret, 67 years old. She came in just because she felt tired. She said, "Doctor, I'm just a little tired. Probably because of my age, right?" When we measured her blood pressure, it was 180/110. Extremely high. She had no chest pain, no headache, no clear symptoms. If she hadn't come in that day, just a few weeks later, she could have had a severe stroke. That's exactly what high blood pressure does. It lives in silence. Until one day, it is no longer silent. So today, let's sit down together, like friends, to talk about this. I want to share with you why high blood pressure happens, and most importantly, what you can do to prevent it. Why is high blood pressure so dangerous? Imagine the arteries in your body as highways. With each heartbeat, blood is pushed along these roads. If the pressure is too high, it's like cars speeding and constantly crashing into the road walls. Over the years, the road walls crack, narrow, and become blocked. And what is at the end of that road? It is the heart, the brain, the kidneys, and your eyes. That is why high blood pressure is not just about numbers. It is related to memory, independence, the ability to see your grandchildren, the ability to walk on your own, and the joy of living a full life. Why does it happen? The hidden causes. You might ask, why me? Why do some people get it and others don't? There are many causes, partly due to us, partly due to genetics. Age. The older you get, the stiffer your blood vessels become. By age 60, 2 out of 3 Americans have high blood pressure. Family. If your parents have it, your risk is also high. It's like carrying an invisible ticking time bomb. Diet. Too much salt, processed foods, alcohol, all raise blood pressure. In the US, canned foods, pizza, and fries are hidden salt mines. Stress. Do you notice your blood pressure spikes every time you argue or worry a lot? Stress doesn't directly cause the disease, but it is a dangerous catalyst. Lack of exercise. The body is made to move. Sitting too long makes the heart work harder and blood vessels less flexible. Weight. Being overweight is like carrying a heavy backpack on your shoulders, and your heart is the one bearing the load. Sleep. Poor sleep, especially sleep apnea, is a silent cause. Many patients are shocked to learn that their loud snoring is actually a pusher that raises their blood pressure. Why is it called silent? The cruelest thing about high blood pressure is that most of the time you don't feel anything. No pain, no aches, no warning. You still go about your day, still smile, still talk, while the numbers on the monitor keep rising. Once I asked a patient, "When do you think blood pressure becomes dangerous?" He replied, "Probably when I feel dizzy or weak." But that is a misconception. When you feel dizzy, it may already be too late. Damage has silently occurred in the arteries, kidneys, brain, long before symptoms appear. That is exactly why we call it the silent killer. How to prevent it? The good news is, we cannot stop aging or change our genes, but we can control how we live. And lifestyle is the most powerful medicine. Let me walk you through a few basic principles, not as strict rules, but as invitations. Eat as if you love your heart. The DASH diet. Lots of vegetables, fruits, whole grains, lean protein has proven to be very effective. Imagine your plate as a colorful garden. Replace salt with herbs, sugary drinks with water, fast food with homemade meals. A patient once told me, "I thought healthy eating would be bland, but now my food has more flavor, rosemary, garlic, lemon, and I feel much more alive." Exercise as much as you can, not to punish yourself, but to celebrate life. 30 minutes of walking, a dance in the living room, some games with your grandchildren. Every step is a gift for your blood vessels. Breathe to relieve stress. The world is always stressful, but your body can learn to respond differently. Try deep breathing, meditation, prayer, or simply sitting quietly with a cup of hot tea. Remember, stress doesn't have to control your blood pressure. Sleep as an act of self-love. Sleep is free, yet many neglect it. Aim for 7 to 8 hours each night. If you snore loudly or feel sleepy during the day, get checked for sleep apnea. A good night's sleep is like a reset button for your heart. Monitor your numbers. Measure your blood pressure daily, not out of fear, but out of wisdom. Record it, see the numbers as a story, and you will feel more in control. Medicine, a friend, not an enemy. Many people fear blood pressure medication. They say, "I don't want to depend on medicine." But think about it. If your roof is leaking, would you refuse to have it repaired? Medicine is not a weakness. It is a protective shield. I remember a 70-year-old man who stubbornly refused to take medicine for many years. Finally, after a mild stroke, he agreed. A month later, he told me, "Doctor, I didn't expect to feel this healthy. I feel like myself again." If lifestyle changes are not enough, don't be afraid of medicine. Consider it a companion, a greater truth. The core of the high blood pressure story is not just about prevention. It's also about choosing how you want to live the years ahead. Do you want to still walk on your own 2 feet at 75? Do you want to still clearly remember the names of your children and grandchildren at 80? Do you want to wake up every morning with a clear mind and a peaceful heart? If the answer is yes, then start today. Not tomorrow, not sometime, but today. Conclusion. What I want you to take away is this. High blood pressure is indeed silent, but prevention is not silent at all. It resonates in how you eat, how you walk, how you rest, and how much you love yourself enough to measure the numbers every day. You don't have to be perfect. Just take small, consistent steps. Ask yourself tonight, what can I do a little more for my heart tomorrow? Can I eat an extra serving of vegetables? Walk a few more steps? Go to bed an hour earlier? Life is not measured only by numbers. But when you protect that number, your blood pressure, you gain more time, more memories, more mornings to smile and say, "I am grateful that I am still here." Thank you for being with me today. If this message touches you, keep it in your heart and share it with your loved ones. Together, we can silence the silent killer and choose life one day at a time. See you in the next video. Until then, stay healthy, be kind to yourself, and listen to the whispers from your body. If you have any questions or want to discuss more, just comment below, and I will reply as soon as I can. If you find this video helpful, please give me a like and subscribe to motivate me to continue spreading health knowledge to the community.